Hello everyone, Dr. Fink here. Today we'll talk about primary versus secondary hypogonadism and each treatment method. Quick disclaimer, this is not medical advice, this is entertainment only. So I mentioned primary versus secondary. So primary is basically a testicular dysfunction. Okay, testosterone is produced in the testicles, and if it is primary hypogonadism means low testosterone, means there's a problem with the testes. Okay, problem with the testes. Secondary hypogonadism is a problem that happens within the brain, in the hypothalamus and the pituitary gland. The hypothalamus and the pituitary gland basically signal the testes to produce testosterone. Okay, so if you have a problem in this region of the brain, you will not signal the testes to produce testosterone. So it could be the reason for low testosterone could be laying in the production side in the testes, or it could lay in the signaling side, which is the brain. All right. So now let's see how this works. All right. So here's the assume that's the brain with the hypothalamus and the pituitary, and these release gonadotropin releasing hormones, GnRH, and this will release luteinizing hormone and follicle stimulating hormone. And those hormones travel down to the testes where they trigger testosterone production. Okay, so LH and FSH, very important to tell your testes to produce testosterone. So what happens in secondary hypogonadism, this area, so hypothalamus and pituitary, there's a problem here, okay? And it means that luteinizing hormone and follicle stimulating hormone are downregulated. And this downregulation will affect testosterone production in the testes and downregulate testosterone production. And this is called secondary hypogonadism, okay, coming from the brain. Primary hypogonadism, on the other hand, there's no problem with the brain. The LH and FSH are usually elevated and they travel down to the testes, but then there's no response to the signal. Okay, so there's a problem here, and the testes do not produce the testosterone that LH and FSH would be signaling. All right, so this is called primary hypogonadism. So how can you determine whether you have primary or secondary hypogonadism? It is very easy. When you take a blood panel, you want to look at your LH and FSH levels. Okay, of course, you want to have total testosterone, free testosterone, but you always want to look at LH and FSH. LH should be anywhere between 1.5 to 9 international units per liter, FSH 1 to 10 international units per liter. And now here's the key. If your FSH and LH are low, let's say they are at 1 and 0.5, this means that there's a problem in your brain, in the hypothalamus and pituitary, since LH and FSH are low. And this means that there's not enough signaling for the testes to produce testosterone. Secondary hypogonadism. FSH, LH low mean secondary hypogonadism. On the other side, let's say LH and FSH are high. Let's say we have LH of 12, FSH of 15. This means that your hypothalamus and pituitary are producing a lot of signaling molecules that travel down the testes, but they do not get the response from the testes. That's why this is primary hypogonadism. Okay, so to recap, if your LH and FSH are low, means secondary hypogonadism coming from the brain. If your LH and FSH are high, it means primary hypogonadism, problem coming directly from the testes. And the treatment for each condition are completely different. Okay, if it is primary, if your LH and FSH levels are elevated, it means that you have to directly treat with testosterone. Okay, and testosterone replacement therapy has side effects such as infertility. So, especially for patients who wish to have children in the future, that might be a big hurdle. On the other hand, if you are secondary hypogonadism and your LH and FSH levels are low, this means that you can trigger the hypothalamus and the pituitary to produce more or to mimic the LH and FSH hormones effects on the testes. And this is usually done with HCG or human chorionic gonadotropin, and it is mimicking LH, luteinizing hormone, and it tells your testes indirectly to produce testosterone. And you will produce more testosterone without having the side effects of infertility as would be seen in direct testosterone supplementation. All right, so big difference between primary and secondary hypogonadism. Always make sure if you check your testosterone or when you check your testosterone levels to check also for LH and FSH so you know where the problem comes from and in order that you can choose the right treatment for your specific condition. All right. I hope you enjoyed the video. Please let me know what you think in the comments down below. Thank you for watching.